So again, this topic is about chapter 3, infection control, safety, and first aid. There are some things that as a phlebotomist you need to be made aware of as to what is your duty in infection control. We talked a little bit about it in quality assurance. We know that there should be an infection control plan somewhere in a binder, and it is your responsibility to make sure you're familiar with the duties that pertain to you as a phlebotomist. So we're going to discuss this into depth into some of the things that pertain specifically to phlebotomists. As a phlebotomist, you're going to be having direct contact with blood all the time. So you are at very high risk for contracting an infection. So you should be very familiar with some of the things that are out there, the hazards that are out there for you, and but more importantly, how do you manage those hazards? How do you reduce the risk of you getting contracting an infection or a virus or anything to that extent? So again, we have to be familiar with the terminology. Just like any other chapter you're going to be discussing, we're going to be using different terms. And if you don't know the term, just go ahead and ask, and I'll clarify it for you, right? But I'll try to do that along the way. We're going to discuss some elements about bloodborne pathogens, what they are, what has the government done to help protect you as much as they can from these bloodborne pathogens, some of the things they expect employers to provide for you so that the risk of you getting a bloodborne pathogen is at its minimum level. There are some signs and symbols that you also need to be familiar with so that you can know what you are getting into as far as hazards are concerned. You have a job, a responsibility to respond to certain emergencies, not only healthcare emergencies, but also electrical fire or any other kind of exposures in the job, especially in the hospital settings, because that is where a lot of these things are done on a daily basis. And if you're an phlebotomist and don't understand what's going on, you might expose yourself to unnecessary risk, right? Another very important topic is, of course, first aid. What do you do when someone is in a medical emergency? How do you respond with first aid? We'll look at some of the CPR guidelines. If you don't have CPR training, make sure you get with Reyes. I believe we might having one tomorrow from 9:30 to about it's an hour and a half, more or less, maybe 10:30 or so, 10:45. So please get with Ms. Reyes if you have not obtained your CPR certification. And a little bit about wellness, how to take care of yourself. In healthcare, all the jobs are very stressful. They're mentally demanding, mentally draining, and also physically. So we have to know how to care for yourself just a little bit so that you don't get burned out too quickly. All right. So what is infection control? I know in quality assurance we discussed this. What infection control is, it's a plan. Okay, it's a plan. But we said also the plan is as good as the people that carry it out. If people fail to follow that plan to the letter, then things go just down the drain. Okay, nothing is going to get done right. There's a lot of infections that are going to be spread out, or going to be you're going to be exposed to a lot more risk than you normally would. Why? Because we're not following simple infection control practices. All right. So infection, it's a condition that results when a microorganism invades your body and your body has a response to it. Okay. This microorganism will go into your bloodstream and start to multiply. Why does it multiply? Because it has everything that it needs. It has nutrients. It has a warm body. It's got moisture. So all these things are a perfect recipe for a microorganism to be able to multiply, to survive, but also to thrive. Okay, it's very important that you understand that infection control is important for yourself, for your patients, coworkers, and of course your family. You don't want to go home carrying around an infection in your uniform, on your hands, and where you can spread it obviously to your family. So at work, again, we do this, we follow these plans mainly to minimize the risk of spreading the infection around to other patients. Phlebotomists do go from room to room, all right? They literally go every single room that you're assigned to. And if you are working with elderly populations or children, you are exposing them unnecessarily, and this is not right for them, okay? Microbes that can you can come in contact with include bacteria, funguses, which love moisture, protozoas, which like to live inside your body, and viruses. Viruses are very stubborn. It's very difficult. As a matter of fact, there is no cure for viruses. As you know, there's a lot of viruses that we can contract that you can, be able to live with, but some of them are more dangerous and they can make you very sick. If those viruses or these microbes make you sick, then we call them a pathogen. Okay, a pathogen is a microbe that's able to make you sick. Okay, it will make your body create a response to that, right? To that, an immune response to that microbe. Communicable infections like the ones we are going through right now, the COVID-19, can be spread from person to person. Therefore, it is a communicable infection. Mostly all infections are communicable. All right, that's how they get spread, and that's how they become endemics and pandemics. The agency, the federal agency that you should be made aware of and know that plays a big role in infection control is the Center for Disease Control. You probably already heard their name many, many times, but this is the agency that goes around the world, or at least in the United States, and they study all these different new bacteria that are coming around, and they don't just study them, but they study them. How do they cross over from, let's say, from an animal to a human? How did that happen? All right, so they go around and study like the bird flu, the swine flu, we know it as a pig flu. There's been so many different flus. Every year we get a different one, and they tell us, make sure that you cover your sneeze, cover your cough, wash your hands, and so on. Use all these precautions. I think everyone probably around the world has become much more aware of how important it is to wash your hands. Okay, it's very, very important. Now, there are specific infections that happen in the hospital, okay? If a patient goes in the hospital without any problems, and then all of a sudden they develop an infection in the hospital, or they get discharged and then they get sick and come back to the hospital, they might have acquired what they call a healthcare associated infection. It's not just in the hospitals, it can occur anywhere. It could be at a doctor's office, as you know. Before, everybody was in the waiting room, the lobby, waiting to be seen. Everybody is sick here. We're all mixed together. And nowadays, I think most clinics have like a divided section where some of them they're in the sick lobby. We have symptoms, and then the other ones are waiting on the second lobby. So healthcare associated infections can happen anywhere in long-term care facilities, also known as nursing homes, hospitals, doctors' clinics, anywhere, as long as it's you're in an area where healthcare services are delivered. It's 1.7 million healthcare associated infections, 99,000 associated deaths each year. These are a lot of people that are losing their life unnecessarily, primarily because they're getting these infections from us, the healthcare providers, right? Nurses, doctors, CNAs, phlebotomists, all of us are guilty of this. So we're the main ones that are carrying things around to other people, and it's not fair for them, all right? So please make sure that you follow strict infection control practices, all right? Moving on. All right, so there's other kinds of bacteria that we are more concerned about because these bacteria are not easily taken care of. Usually at home, you might, develop an infection, maybe a respiratory infection. You take an antibiotic for a few days and it'll go away. But there's some bacteria that you need to be conscious about that do not go away, and we take extra precautions for that. Okay, so bacteria such as MRSA or MRSA, we call it a MRSA. Now, this is what they call methicillin resistant Staph aureus. We have Staph aureus in our skin. It's part of a normal organism in our skin. However, when people take antibiotics over and over repeatedly for any little thing, a cold or something like that, they take antibiotics. These bacteria will eventually grow resistant. All right. So we see this a lot in the older patients. Why? Because they go to the doctor very often. Doctors prescribe antibiotics all the time because people demand them, all right? And so they eventually develop this kind of infections, this kind of bacteria. And again, they spread them to a nurse or a healthcare provider. And next thing you know, another patient has it because it's spread because of poor infection control practices, and it becomes very difficult to get rid of them. Another one that's also very common, and this is not a resistant strain, but very common, is called C. diff, Clostridium difficile. All right, this infection or this bacteria organism lives inside our body. Okay, it lives in our small intestine. Clostridium difficile is part of our natural flora. Okay, it helps our body stay healthy, but you cannot have too many of it in your intestines because it will create diarrhea, and we're talking about major diarrhea that can happen for over a month. So you definitely don't want to contract C. diff. All right, a lot of these patients have developed C. diff again from overtaking too many antibiotics. So think about it. If you have an infection, let's say you get a respiratory infection and you go to Mexico to go get an antibiotic, okay? When you're taking that antibiotic, guys, it's not just killing, right, specific or the organism, that you're sick with, but it also wipes out a lot of your natural, normal, what we call intestinal flora, or the bacteria that live there, okay? So we all live there, have bacteria, okay? Uh, don't think you don't have it. We all have them. They're there. Okay, that's why anything that creates bad odors, it's produced by bacteria, right? So when you take an antibiotic, this antibiotic kills a lot of your natural good flora or intestinal bacteria. And what happens? The other bacteria overpopulates in your intestine, giving you a problem like diarrhea. Okay, so it's really important that you don't self-medicate at all. You should actually go see a physician to prescribe medications for your problem. Enterococcus. Entero means your intestine, and the abbreviation coccus, C-O-C-C-U-S, refers to the shape of the bacteria. In this case, we have a round-shaped bacteria. Okay, so that is also a common infection that is contracted mainly in the urinary system. Why? Because of poor hygiene. People are not following good hygiene, hand hygiene practices. The elderly people sometimes when they have fecal incontinence, urinary incontinence, they get this infection very often. Okay, so MRSA is one of the multi-drug resistant bacteria. E. coli again is another bacteria that lives in our intestine, Enterococcus coli. You have to be careful with it because it is contagious. Okay, most of these organisms that I'm talking about are contagious. We call them direct contact, right? It means that you can only contract it if you have direct contact with that person, right? Yeah, so you have to be careful. You have to wear your personal protective equipment. In this case, you would obviously need gloves. You would obviously need a gown to make sure that you don't contract that bacteria into your uniform and carry it on to the next person. So again, be careful with every patient that you see. If you see a sign on the door that is signaling you to go to the nurse station, or it's telling you to wear certain PPE, please follow the recommendations. If you don't follow them, you ask. Okay, if you don't know, you ask. All right, and move on. Okay, so one very important thing that we need to know, okay, that we need to understand is how is that organism going from one person to the next? Okay, I just spoke about some organisms that are passed on directly, right? So you have to understand the chain of infection. Okay, what is the agent that is making you sick? Okay, let's say for example we have COVID-19. All right, COVID-19 as of right now, we believe it's passed on through the droplet, like talking, spitting, coughing, sneezing. That's what we believe it's spreading. Okay, and there was a few times some people were saying that it was airborne, which is much more dangerous, okay, much more difficult to manage. But we have to identify the agent and how is it making it from one person to the other, okay? So in the chain of infection, we have five, we need five elements. Number one is the agent, the infectious agent, the pathogen, the one that is making you sick, okay? What is it? So the CDC will go around and obviously investigate, grab samples of, from the nose, from the mouth, all this kind of stuff, right? And they find out, oh, they name it, they give it a name, okay? So now we know it's COVID-19, all right? Where was it living? Well, as far as we know, it was passed on through supposedly some of those wet markets, they call them, where they sell live animals, and it was passed on from one animal to a human, and then so on. That's what we were told in the beginning. But every organism needs a reservoir, okay? These organisms cannot live without a reservoir. A reservoir could be an animal. Why? Because they're alive. They have nutrients in them. They have moisture. Okay, they have a good environment. So that's all they need. Humans are the perfect reservoir. Okay, but you could also have other reservoirs like uh, buckets with water. Okay, or moisture. Let's say in the restroom, there's water always in the faucets. Bacteria love that. Okay, so moisture, nutrients, they can a perfect environment for these agents, either bacteria, fungi, viruses, whatever it is. So the reservoir is the source of the agent, okay, the bacteria. And say I'm carrying around COVID, okay? I don't know I have it, but I can carry around and then pass it along, and nobody knows, and I don't know. So this agent will live in me until it makes me sick and starts to give me symptoms. Then I'm going to realize, wait a minute, something's wrong with me, and I may test positive for COVID-19. Thank goodness I haven't, but it could happen to anybody, at any point. Even though, thank goodness, we're kind of, turning the corner around. Hopefully, with this virus, we still have to be very cautious. Okay, people are still traveling. They're traveling now more, so bacteria travels with them, and it goes to another area, and that's just the way bacteria travel. Okay, so we have to understand um, the agent, the reservoir, and then a pathway. How does this organism make it out of the body? How does it travel? Well, we talked about the bacteria that travel through direct contact, right? I touched this person, I got in contact, I got it in my hands, I didn't wash my hands, I go to the next patient and I pass it on to them, or shake somebody's hand, touch my face, etc. Okay, so how does this bacteria or agent travel? You have to understand how it travels. That way you can better control it. Okay, so we have to have an exit pathway. In this case, with COVID-19, we know that our nose, our mouth are the main exit pathways. We sneeze it out, cough it out, speak it out, we talk, saliva comes out, it lands on the surface, on the table, somebody comes around, puts their hand on the table, and so on. Okay, the cycle repeats itself very quickly. So the means of transmission, again, there's three means of transmission that we'll talk about. Very important that you understand, all right? Airborne. Airborne means suspended in the air, all right? If a person jumps off a plane into the air with a parachute, obviously, right? They're airborne. They are suspended in the air for a certain amount of time. Eventually, they make it to the ground safely. Bacteria do the same thing, right? When somebody has an airborne infection, you will cough it out, sneeze it out, speak it out, and it will stay suspended in the air. Why? Because that virus or bacteria is so small, so small. It's like sometimes when you see a ray of sunshine going through your window, and in that ray of that light, you see like dust. It looks like dust hanging around. Well, there's also a lot of bacteria hanging around and viruses that hang around in the air. These are called airborne, right? And it doesn't take a lot for you to walk in there and breathe it in. Now it's in you, okay? So again, airborne are very difficult to manage. We require N95 masks to control this, okay? That's why I always wondered when they were saying, well, COVID-19 is a droplet. Well, in this case, we just need a cloth mask, right? But no, in the facilities, they make us wear N95s, which are special masks. They have a special filter to be able to make sure that that organism doesn't make it, into me and then into others, and I'm going to carry it around. So N95 masks are needed for airborne. Okay, one of the most common ones is tuberculosis. Tuberculosis is a long time bacteria that can live in your body for many, many years. Okay, can stay there if you're exposed to it, and eventually when your immune system goes down, it'll make you sick. All right, so usually it happens in the later stages in life. People that contract tuberculosis are usually come from countries where they are not screened for tuberculosis. Here we are screened all the time. As a matter of fact, we are screened every year. All right, so again, remember, we are have to follow any infection control practices as it relates to airborne. Okay, so airborne precautions requires, again, your N95 mask and your gloves, okay? You don't necessarily need a gown, okay? But some people may require you to wear a gown, especially right now with this pandemic. People are asking you that you wear a gown if you're going to go into a patient that has COVID-19, okay? So contact precautions, like the ones we talked about earlier, C. diff, MRSA, E. coli, all right, all of these require contact precautions, okay? You can only contract it by direct contact, like touching someone that has it, okay? Or somebody has an oral bacteria and you kiss that person or whatever, you may come in contact with it. If you touch contaminated objects, like in the hospitals, if a patient has let's say it has E. coli and they touch themselves down there, and then they touch the bed rails, they touch everything else, and you come into the room and you don't know what they have, and you don't know that they've been touching everything else. Well, you might indirectly contract that bacteria. So again, this is why it's very important that we use gloves all the time when you're coming into contact with the elderly people. All right, or any patient rather. You don't need to be elderly. Any patient that has is potentially infectious. Okay, so you treat everybody as potentially infectious. Doesn't matter if they're young or old, right? Now, we have to have an entry pathway. The entry pathway is usually the same as the exit pathway. If you sneeze and cough out any bacteria or viruses, it goes into your, to your body, or you cough it out. I'm sorry, you sneeze it or cough it out. Usually, it's going to go in the same way, right? Inhale it in, okay, and you're going to contract that virus or infection. So the entry pathway could be any orifice in your body. It could be your eyes, okay. You might get an infection in your eyes, your nose, your mouth, your genitals are also entry pathways. An open wound could also be considered an open airway. So again, make sure you understand the chain of infection. Okay, so we need an agent, right, or a pathogen. We need a mode of transportation. Okay, how does it make it from one place to another? Okay, we need an exit. How does a bacteria make it out of the body? Okay, how does it travel? Okay, with mode of transportation. How does it make it into your body? And lastly, a susceptible host. Bacteria cannot make just anybody sick. If you're healthy, you're young, okay, you're well rested, you are not susceptible. Okay, as you've heard with COVID-19, is everybody susceptible? No, for some reason, kids were not as susceptible as older people. All right, the immune system of older people is very weak usually. Okay, so they were very highly susceptible to COVID-19. So someone with a decreased ability to resist infections, such as a person with HIV, a person that is on chemotherapy, radiation therapy, etc., they are susceptible hosts. All right, and of course, kids are very susceptible to a lot of other infections, except this one, COVID-19. Obviously, they were not very susceptible. Otherwise, we would have been real bad pandemic. Okay, so age, health, your immune status, all that plays a role in your immune response. Okay, the best way to stay immune is to eat well, get rest, okay, and stay healthy as much as you can. So here are again are the elements of a infection control. Your agent, all right, a bacteria, fungus, or whatever. A reservoir, where does it live? Animals, humans. A bucket, okay. An exit pathway, how did it make it out? Through your blood, to saliva, mucus, coughing. All this is an exit pathway through your nose, through your mouth, through your genitals. And immune transmission, how does it travel from one person in one place to another? Okay, did it travel through the air? Was it suspended in the air? Did somebody cough it, sneeze it like a droplet? Did you get it through a mosquito? Do mosquitoes carry it around? Okay, so there's a lot of means of transportation. So that's why it's important that we understand how they travel, so that we can make sure that we can take control of this bacteria. How does it make it into our body? Okay, is the insect going to have to bite us? Are we going to inhale it? Okay, what's going to happen? Is it comes in through an open wound? And of course, you need a susceptible host. Okay, that would be us, someone with a weak immune system. So your job, our job, is to make sure that we break that chain of infection at some point. When we understand everything about this bacteria, like these links, then we can go ahead and start trying to stop or control the spread of infection. Okay, so in COVID-19, we finally understood that it's droplet, supposed to be droplet. Okay, and we understood that by wearing a cloth covering in public, an N95 in the facilities, wearing gloves, and sometimes even PPE, we were able to control the spread of infection from person to person. Okay, of course, hand hygiene, washing your hands, is the most important way. Okay, there is no way around it. Hand hygiene is by far the best way to control the spread of any infection. All right, nutrition, rest, getting immunized. The flu shots are out there now. If you are interested in getting a vaccine, control any insects or rodents, whatever the cause or the source of transmission for any agent, you need to make sure that you control that. Follow all isolation procedures. Okay, so when a person is on isolation precautions, you're going to see a sign on the door that it's going to tell you what kind of PPE you're going to wear. It's going to say, it may say contact, it may say airborne, it may say droplet. All right, so make sure you understand what those are. All right, and before I go on, there's standard precautions, or your basic precautions. Okay, what does it mean to to take standard precautions? All it means is you're going to wash your hands and wear your gloves with every single patient. It doesn't matter who it is, what age, where they are. You're going to take your standard precautions with every single one. Right? Now, once a person develops or contracts an infection like the ones we just talked about, okay, a droplet, airborne contact, then you're going to take additional measures. And we call those transmission-based precautions. All right. So you say, well, this person doesn't have anything. What am I going to do? Well, I'm just going to wear gloves and wash my hands every time I go into the room. The same person now contracts an infection like COVID-19. What am I going to wear? Okay, well, I'm going to wear gloves, yes. The mask, the N95, and of course now maybe a gown. Okay, whatever isolation precautions they ask you to wear, you need to follow them. All right. If not, you're increasing the risk of you contracting something or somebody, another patient, more important. Infection control programs are there to protect patients, employees, visitors, and others. Again, we have to keep it very much under control to break the chain of infection. If we don't break that chain, then the infection just perpetuates. It keeps on going and on forever until we actually take measures to stop it. Our job is to monitor and collect data on all infections occurring in an institution. Very important. Once one person contracts an infection, right? And let's say, for example, nursing home, if one of the residents is diagnosed with resistant type of bacteria, it has to be reported to the state. We have to put them on isolation precautions and everything else in between. Okay, we have to do a lot of other steps and documentation and special care for that person so that we don't spread it to the following residents. Remember, their immune system is low. So an infection control institutes special precautions in event of outbreaks. Again, the components of a program should include employee screening. Right now with COVID-19, we're all getting screened twice a week, but thank goodness now it's down to once a week. Okay, we evaluate and treat everybody. If you were tested positive for COVID-19, you were evaluated right away. You were put on quarantine for 14 days, given treatment, if any, if you had any symptoms, okay, and you were being monitored. Yeah, I know it. There was a time when there was these people that were called the tracers. They were calling people up and finding out how they were doing and who they had come in contact with and so on. It was getting pretty out of hand, but thank goodness that it's finally, I think, under control. The numbers are decreasing week by week. Again, so the most important hygiene practices are hand hygiene. Okay, use your antiseptics, your gels, your foams, of course, hand washing. Wear your PPE, your gloves, gown, mask, whatever. Face shields. Oh, we've been using face shields already for a long time. And of course, your respirators or N95 masks. All right. Make sure you know what they are and when you have to wear them. You're gonna see this on the test. Okay. Very important that you know how to put on and take off your gloves. Okay. So to remove your gloves, guys, always make sure you have your gloves on. Okay. Let's say your dominant hand, you're gonna pinch the glove from the middle of your opposite hand, pinch it, and slowly pull it out, peel it out of your hand, and roll it into a ball. Right? Now you have a gloved hand with a dirty glove. With your ungloved hand, you're gonna come under the glove and peel that glove over the dirty glove that you just took off. Okay? So we say glove to glove and then skin to skin. Okay? That is one of the ways that you want to prevent your clean hand coming into contact with a dirty glove. Okay? So make sure you know how to do that. Okay? The respirator, there's an example of an N95. Okay, make sure that you know when to use it. You don't use them all the time, only when it's necessary, when a person has a droplet or a airborne infection. Okay, you also have to know this. Make a very important note, guys. You have to know how to put on your PPE. All right, and here's the order right there. You've seen it. To put it on, you put your gown, your mask, and your gloves. Okay, assuming this is the only PPE that you're going to wear. Okay, gown, mask, and gloves. So first you put on your glove, you open your gown, okay, I'm sorry, your gown. You're gonna open it without the gown touching the floor, right? You're gonna put it on. You're gonna tie it down around your waist and around your neck, okay? After that, you're going to put on your mask and finally your gloves, okay? Your gloves should go over your gown. I believe it is a tested item in the nurse assistant exam. So if you haven't practiced that, make sure you know how to do that. Now, it might be a little different in the CNA test, but make sure you follow those steps for that course, okay? Now you're gonna have to take off the PPE once you're done taking care of the patient, all right? How do you take it off? First, gloves, how we just said. Glove to glove, skin to skin, throw that away, then untie your gown, untie your gown. You're gonna take it off on the inside. So we're gonna put your clean hand in the inside of the gown because the inside is clean, the outside is contaminated. And you're gonna peel it off, okay? Peel it off without making contact with the outside. You're gonna roll it up into a little ball, get rid of it, okay? And then finally your mask, okay? So you have to know this order, guys. Put it on and to take it off. You are gonna see it in the exam. Very, very important. Isolation procedures, again, it's very important that you understand what kind of isolation methods or practices you're gonna do with certain patients. You're not gonna do it with everybody, just with some, okay? Scrubs or other pants that are touch the floor can easily pick up infectious material. So according to CLSI laboratory safety guidelines, pants worn by laboratory personnel should be 1 to 1.5 inches off the floor to prevent contamination. Okay, obviously, you don't want your clothes to be dragging on the dirty floor. You'll be carrying that around forever. Some of the examples of isolation procedures include protective or reverse isolation. We use this when a person has a weak immune system, someone with HIV, someone with cancer, on chemotherapy, radiation therapy, their immune system goes really, really low. And if you know that you have a cold or you have something that you might spread to them, number one, avoid going to that room. Number two, if you are going to go over there, make sure that you wear a mask or whatever equipment that you need. Do not expose them unnecessarily. Okay, this is what we call reverse or protective isolation. Traditional isolation systems, again, they're category specific, disease specific, right? It could be contact, droplet, or airborne. Okay, so you're gonna have to follow those specific guidelines. Standard precautions are also called universal, and I said what those are, right? Always washing your hands, always wearing your gloves, right? Body substance isolation goes beyond universal precautions. For example, somebody that has um, a urinary infection, okay, like MRSA or E. coli in the urine, you have to take extra precautions for that. Standard precautions, I just explained what those are. What it really means is that you treat every body fluid as contagious. If somebody's incontinent of urine, okay, does it mean they have an infection? No, but it doesn't mean they don't have it either. So you have to make sure that you take your precautions, right? If a resident, you're going to help a person, a resident with a personal care, especially perineal care, make sure you wear gloves. Okay, you don't know what they have, what they're carrying around, and if you go around, in their environment without gloves, you don't know what they've been touching. So you have to make sure that you wear your gloves. Okay. Hold on one second, guys. Let me get my charger. Is everybody there? Everybody doing all right?
Yes.
Hello? Anybody there?
Yes, I'm here.
Yes.
Hello? Are y'all there?
Yes.
So we
Yes.
continue
Yes.
conversation in biosafety. You've seen this symbol before, right? You've seen it in the sharps containers. You're going to see it in other plastic bags. This is a biohazard or biosafety symbol that you need to be familiar with. So if you ever are going to deal with any kind of sharps or any body fluids, you're going to see this symbol. If you're going to dispose of any needles that, of course, have blood, which is a body fluid, they are considered contagious, possibly contagious, so they're disposed of in a container that has a symbol like this, okay? Biohazard exposure routes, of course, everything that comes out of the body in any shape, way, or form is considered a biohazard. Okay, there be airborne, ingested, wound drainage, anything that comes out of the body through the any orifice considered a biohazard. Now, you have to be familiar with this kind of hazards, which include bloodborne pathogens. Bloodborne pathogens, all it means is that the viruses or bacteria came directly from the blood. All right. So your best defense, or one of the most common ones, is hepatitis B. Hepatitis B virus attacks the liver, and gradually, slowly, it kills the liver. All right, causing a liver cirrhosis in the long run over many years. Hepatitis D is not very common, but hepatitis B is. It's most commonly transmitted through direct contact. If you have contact with somebody that has hepatitis B and you perform a venipuncture on them and then you puncture yourself accidentally with that needle, you might contract hepatitis B. However, good for us, there is a vaccine that can help us minimize the risk of us contracting that. All right. So make sure that you obtain the hepatitis B vaccine. As a matter of fact, you guys have already had it when you were a child, when you were an infant, then a child, and then up to, I believe the last dose you got was around 14 years old. You were given another booster vaccine for hepatitis B, right? But as we get older, our body loses some of that immunity. So it is important that you obtain what they call a hepatitis B titer. A titer is like a level of immunity. That what it is they check your blood to see if you still have immunity to hepatitis B. And if you don't, you can get a series of booster shots. Okay, so you have to know this. You have to make sure that number one, you obtain hepatitis B. Okay, your employer by law is required to offer it to you, and you're supposed to accept it if you want. Okay, a lot of people will discourage you from taking it because it's not expensive to them, but do not waive it or refuse it. Go ahead and take it if you want, and that way you are protected at least from hepatitis B in case you ever get exposed to it. It is common. So again, you're gonna be working directly with blood all the time. The best thing would be to consider taking it. All right. Oh, it is present in the blood and other body fluids. Can survive up to a week in a surface. Okay. Transmitted via needle sticks and sexual contact. So again, make sure that you very careful with needles. Okay. The symptoms from the onset when you contract hepatitis B are like a flu, just like any other infection. Abdominal pain, nausea, you lose your appetite, and sometimes people become a little bit yellow. So you see some of this what we call jaundice on their skin, right? But it's not, thank goodness, it's not very common that we that we see hepatitis B spread nowadays. Another one is hepatitis C. It's from the same family. It's B, C, D. All right, and there's an alphabet of hepatitis, but the most common ones are B and C. Okay, this is again someone that has hepatitis B, he can give it to you via direct blood contact. Okay, and the symptoms are very similar to hepatitis B. Now, there is no cure for hepatitis B. There is no vaccine for hepatitis C, only for hepatitis B. All right, so what does the government say? What do they do to help us or protect the employees? Okay, OSHA is the Occupational Safety and Health Administration. They oversee they oversee facilities, companies to make sure that they are providing for their employees the safest environment. Just like contractors, right? That and they're in construction business, they have to provide their employees, a hard hat, maybe boots, or require, steel-toe boots, and so on. In healthcare, they also require healthcare facilities like hospitals and nursing homes to be able to provide for us what we need to be safe in our job. For example, gloves. We cannot work without gloves. Okay, it's very important. So OSHA mandates that they provide gloves. That's one of the requirements. Okay, if a person develops a specific type of infection, well, that facility has to provide for us all the equipment necessary. Okay, so OSHA had developed a standard for bloodborne pathogens. It is an enforceable law, meaning that if the company violates it, they will be fined for every incident. Okay, the law is intended to reduce or eliminate occupational exposure to bloodborne pathogens. So what else do we need besides gloves? In phlebotomy, we also need those engineering controls. Okay, those safety features that are on the needles, on the tube holders, uh, the Sharps containers can also be considered an engineering control, okay, because they have those little one-way valves that open only in one direction. So OSHA demands that, okay? They demand that the employers offer us, or not offers, but provide PPE for us, and they give us the training. And if we ever get exposed to something, they have to make sure that they have a plan, okay, so that we can get medical treatment and be monitored after that. Okay, so it's not just about the equipment, but also about the aftercare in case we do get exposed, and because some people will get exposed at some point. So the availability of the vaccine for hepatitis B, again, it's a requirement from OSHA. So don't refuse that vaccine if you ever get it offered. Make sure you get it. Okay, it's a series of 3 vaccines, and we'll go into the requirements in just a bit. They also came up with something they call the Needle um, Safety and Prevention Act. Okay, it's very important that the government help keep the employees safe. So they came up with this idea of a Needle Safety Prevention Act. This act imposed additional requirements on healthcare employers concerning Sharps procedures. Okay, in order to keep those needle sticks at a very low level. So what happens if you get stuck with a needle? Well, the facility again has to have an exposure control plan. Okay, it must be in writing. Okay, it must be in writing. You can't just say, oh, well, you got exposed. Well, you know what? We'll go to the doctor, and they have to have all these things already written, ready to be used once somebody gets exposed. It has to be reviewed and updated at least annually by the facility, meaning that if someone is exposed, okay, they have to go back and see, well, how many exposures did we get per 1 year? 0, fantastic. 1, 2, 3. So this gives them an opportunity to review their policies. All right, maybe their policies are not very effective. So again, this is why they have to be reviewed once a year. Non-managerial employees, which means us, the actual workers, the ones that are out there getting exposed to these bloodborne pathogens, have to participate in this development of a plan. Okay, why? Because we're the ones that are getting exposed. We know how we're getting exposed, what's going on. All right, so they have, by law, they have to involve us in developing the plan. Okay, identifying, reviewing, and selection of the plan. Bloodborne pathogen exposure routes. We get exposed to bloodborne pathogens in many ways through the skin, okay, like getting stuck with a needle, blood, something that gets splashed in your eyes or nose, the mouth, right? Blood or other body fluid contacts. cut scratches. If your skin is open for some reason and you come in contact with someone, you have a very high risk of getting contracting an infection. So that's why we have to wear gloves. A human bites, one of the residents gets upset, a patient gets upset and bites you, you might contract something like that because hepatitis B and C are in the saliva, could be in the saliva because of, if they have blood in their mouth. Exposure incident report has to be completed after you are exposed. Okay, if you have a needle stick, you must report it, guys, right away. Okay, but there are certain steps you got to follow once you get exposed. The needle stick or other sharp object injury, if you get exposed, just if it's a big piece of glass, of course you have to remove it. Okay. Number one thing you have to do if you get exposed is to wash the site with soap and water for at least 30 seconds. Remember this, highlight it, write it down, tattoo it on your arm, but do something. Wash with soap and water for at least 30 seconds when you get stuck with a needle, okay? Or you're exposed to a sharp object that has body fluids like blood, all right? Mucous membrane exposure. Mucous membranes are your eyes, your nose, your mouth, okay? Genitals. Flush the sides like your eyes. Okay, something splashes into your eyes, flush it with water, could be regular water. There's usually going to be an eye wash station. You have to know where that eye wash station is, okay? For at least 10 minutes or 10 minutes. Especially your eyes, they absorb bacteria very, very quickly. Okay, so you have to make sure that you rinse that area for at least 10 minutes. Use the eye wash station if available, okay? Or have somebody pour water over your eyes. Remove any contact lenses if you have them on them and disinfect them. Report the incident to the immediate supervisor after you giving yourself some first aid, okay? Then you report it right away. Report directly to provider for evaluation, treatment, and counseling, all right? If you're exposed to someone with HIV, you gotta rinse off first for at least 30 seconds, right, with soap and water, and then report it, and then they're gonna send you for medical treatment to get evaluated, okay? They're gonna check to see, make sure you didn't contract anything. Very important that you follow those steps, okay? First aid is first, always, for yourself, okay? Forget about, going to the ER. Go wash your the area first. Of course, we have to work in a clean environment, okay? We have to make sure that we disinfect surfaces. Remember the difference between antiseptics and disinfectants. Here, we're going to talk about disinfectants. If you're going to be cleaning an area that is infected with body fluids, let's say you spilled blood or urine, whatever it is, you have to clean up with a 1 to 10 solution of sodium hypochlorite. Remember, sodium hypochlorite is the word for bleach, all right? So that is what we use to clean up any body fluid spilled, all right? Now, if you're going to just clean the areas, okay, the desk, the counters, things like that, it's a 1 to 100 solution, okay? It says 1 milliliter of bleach to 100 milliliters of water, okay? If you're gonna make 1 liter, then obviously it's 10 times that, right? 100 milliliters of bleach and 1,000 milliliters of water. All right, so it's a 1 to 100, and 1 to 10 is for uh, body fluid cleanup. Okay, clean up body fluid spills with EPA-approved chemicals. Remember, these are for disinfectant, not for human use. Yeah, please, you have to wear gloves because that might be irritable to your skin. And absorber material. When you're gonna clean up a spill, guys, you have to remember that you have to contain the spill, okay? And to be able to contain it, usually they pour things on it, something like that can absorb. It could be something like, it's not kit litter, but it looks like kit litter, okay? That they pour over the spill, it contains it, okay? You spray that disinfectant, it kills it, and then it's picked up. Obviously, you have to wear your industry gloves, okay? You can't use this regular gloves, okay? We're going to dispose biohazards, okay? Everything that is non-reusable, they're single use, like your needles and all that kind of stuff, okay, has to go in the biohazard sharps container. Again, only sharps. Do not dispose of gauzes and things like that in the sharps container. They don't go there, okay? That is only for sharps. One more thing, I'm gonna take a little break, all right? So we talk about electrical safety. This is one of the questions that I've heard been in the test. What do you do when somebody gets electrocuted? Okay, shut off the source of electricity first. Okay, if you can, disconnect the appliance, the object, whatever it is, disconnect it. Okay, use non-conducting item to remove the source of electricity from the victim. If possible, something that is non-conducting like plastic or wood can be used. Okay, call for medical assistance. So when someone's electrocuted, call for medical assistance. If the patient does not have a pulse and they're not breathing, you're gonna have to start CPR, okay, and keep them warm. Remember these steps, guys. This is first aid. You're gonna help, one of your fellow coworkers that got electrocuted. This is what you do. You have to make sure that you follow the steps, right? That you know them, because there might be a question in the test that will ask you, what are one of the things that you should do when rendering first aid somebody that got electrocuted? And you might think, oh well, I should remove, shut off the source of electricity, but that's not one of your answers. So you're like, oh my God, what do I do now? So you have to know all these measures, okay, in that specific order. You have to know them so that you can be able to respond to that medical emergency if necessary. Okay, so I'm gonna pause for just a bit, okay, and we're gonna resume. All right. Fire safety. Everybody needs to know about fire safety. Everybody in the entire facility has to know about fire safety. So if you are working in a facility, hospital, nursing home, whatever it is, you have to make sure that you know the acronyms about RACE and about PASS. So you should know that what procedures to follow in case there is a fire, where are the new exits, where are the fire extinguishers. You should know how to make sure that all the hallways are always clear on one side of the hallway. Who do you remove first, who's last, and so on. So this is part of your job, so you need to make sure that you are aware of that. Know where the exits are, the evacuation routes, and so on. Components needed for fire to occur. Obviously, you need fuel, heat, and oxygen to start a fire. But most importantly, you have to know how to control a fire. Okay, very important. Here's the fire tetrahedron. Obviously, you need the oxygen is what makes that fire burn faster and sometimes stronger. Fuel, whatever it is that makes that fire burn longer. We need to also control that. There's different kinds of fires that you should expect. The most common ones are usually Class B fires. Class A fires are usually wood and paper. B fires are more flammable liquids like gasoline, vapors. All right. Class C fires are electrical. For this reason, we usually have in the facilities fire extinguishers that can deal with A, B, C fires, types A, B, and C. And you should know how to use that fire extinguisher, including using the acronym PASS. All right. You don't have to worry too much about Class B or Class A fires since there's more like protection in other environments. Radiation safety, however, let me go back and just rephrase. So RACE is rescue, alarm, contain, and extinguish, which is the order you need to react to patient safety. Remove, activate 911, contain fire if possible, and evacuate the facility. All right. And to be able to use the fire extinguishers, make sure that you remember that you have to pull the little pin that is in the extinguisher, aim at the base of the fire, squeeze the handle on the extinguisher, and then make a sweeping motion to turn off the fire. We move on to radiation safety. The principles of radiation exposure. If you are a young female that is of childbearing age and you think you might have a child or be pregnant, then you should not go into a room that has radiation, all right? But if you're not, you're pretty sure that you're not pregnant, you should make sure that you keep your distance from the person. Usually there's going to be a shield, a lead shield in front of you between you and the patient. There's going to be a lead vest that you also have to wear. And there's a small device that you put on yourself so that it measures the amount of radiation that you're exposed to, and we have to keep a record of that. So distance shielding and time is what you need to make sure that you're aware of as far as safety for yourself. The radiation that patients have are usually devices that are inserted into the vaginal orifice, more commonly in females, and that's how they receive radiation therapy for problems like ovarian cancer, uterine cancer, cervical cancer, and so on. Chemical safety. General rules, always wear your PPE. Of course, if you're going to be dealing with chemicals, clean up any chemical spills properly. There are chemical spill kits. All right, so these kits have specific items that are in there so that you can be able to contain, for example, let's say a chemical is spilled in the laboratory. You need to know how to react to that. You make sure that you get a spill kit. Do not try and pick up any chemicals wearing simple gloves. You're going to need the specific items that are in the kit so that you don't come in contact with chemicals that might be hazardous to your health or burn your skin or things like that. So remember that you first get the spill kit. OSHA hazard communication has come labeling requirements. Everything that we come across as far as chemicals has to have a label in it, how dangerous it is for health. Is it dangerous or is it poisonous? Is it toxic, flammable, combustible? Does it can go up in fire? Okay, so all these items are required by OSHA to be on the products that we're using. Okay, so that we can make sure that we are more cautious. Okay, in case we don't want to cause a fire or an explosion that might cause injury to us or to others. You have to know where the safety data sheet. The safety data sheet is a binder. It's more. It sounds like it's just one sheet, but it's actually a binder with all the information about chemicals that are used in your facility, more specifically in your lab area. All right, so you have to know where the safety data sheets are. You don't have to know what's in them so much, but where the binder is located at. And they're usually going to be labeled with bright colored, okay, large text so that you can see that and you have access to it. You have to be accessible to you. Chemical safety, Department of Transportation labeling systems. Again, this is more for companies that uh, carry various chemicals that are either flammable or they're hazardous to our health. They have to have all these different numbers on them and symbols so that we understand that we have to be cautious. Next time you drive in the road and you see a one of those big pipe looking trucks, and they usually carry gasoline for cars. They go to the gasoline stations, look at those symbols, and you're going to see, is it flammable? What is that four number? What does it mean? The color on the square rectangle. Okay, so these are all numbers that have a meaning, but as soon as we see a fire, we know that we should probably stay our distance. This is another diagram that the National Fire Protection Association came up with. Okay, now you don't have to be too much knowledgeable in this for exam purposes, but just for your own knowledge. Okay, the blue means health, or signal blue, it means it could be dangerous to your health. The red colored means obviously flammable, and three usually has to do with radioactivity. If anything is radioactive, if you see yellow, you have to be careful, okay, especially if you might think you're pregnant. All right, what do you do if you are ever exposed to a chemical, right? If you're splashed or you come in contact with a chemical, remember that first aid is always first for you, okay? Know where these showers are. These safety showers, they're located usually on every floor, okay? So you have to know where they are. The eye wash stations, same thing. In case, remember, you are gonna wash your eyes for a no less than 10 minutes, okay, with regular water or sterile water, whatever's available for you, okay? And if you come exposed to a chemical, it's a little bit longer. Flush the affected area for at least 15 minutes, okay? So any punctures or needle sticks, at least 30 seconds, right, with soap and water. Any contact splashes to the eyes, at least 10 minutes with water, and chemicals, at least 15 minutes in the showers, okay, those safety showers. Of course, after that, you report it to your supervisor, and they'll send you to get medical evaluation. It's an example of a spill cleanup kit. All right. The gloves are not your regular gloves. They're usually more industrial um, type gloves. Are thicker. Okay, they can be exposed to different chemicals without causing injury to you. Safety goggles. Okay, there's that super absorbent material they pour on the spill so it can pick up the chemicals. And of course the little broom and the little shovel to pick up all the equipment. First aid is very important, and you'll see some of these questions on the national exam. If someone is having a hemorrhage is a serious bleeding. Okay, it's more than just a small blood. You have to remember to apply direct pressure to the site. Okay, always apply direct pressure to the site. Either you tell the person to apply direct pressure on themselves while you put on your gloves, all right? Hand them a paper towel, a piece of cloth, whatever it is. Make sure they apply direct pressure until it stops while you put on your gloves. After that, once the bleeding or the hemorrhage has slowed down or stopped, you're going to apply a bandage, okay? With enough pressure to contain the bleeding, but not too much pressure where you're going to stop circulation to the distal area, okay? We don't use tourniquets very often anymore. The reason being that a lot of people would forget to remove the tourniquets. So they're not used very much. So as a last resort, let's say somebody actually loses their leg and is bleeding to death, and a tourniquet would be okay. So your original compress should never be removed. Once you apply a gauze on somebody that is bleeding, leave it on there. Do not remove it. You just add more gauzes and more gauzes, okay? Because if you remove that original gauze, you're bringing up that platelet plug, that little um, plug that is stopping the bleeding. You're going to bring it along with you, and the bleeding continues. So never remove the original gauze. Just put more gauzes on it if they become saturated, all right? But front pressure should be sufficient to contain the bleeding. Shock. What is shock? It's not electric shock. Okay, shock is when your body goes into shutdown mode, pretty much. If your body is starting to shut down because of either infection, a severe infection in your blood, or there is a lack of blood in your system, it will gradually slow down and shut down. Okay, the person may become in unconscious. It doesn't mean that they're dead, right? It means that their body's trying to preserve the vital organs. Okay, and it does that by going to energy conservation mode. Okay, so the definition of shock is a condition involving insufficient return of blood to the heart. Okay, it could be hypovolemic shock, which is when somebody has very low volume, okay? Or septic shock, when somebody has a severe blood infection where all the toxins of that bacteria go to all your organs and those organs themselves start to shut down. So that's another type of shock. Regardless of the cause, okay? The heart or the tissue does not receive enough oxygen and the person starts to show symptoms of paleness. So the person becomes very pale, cold, cold and clammy, become very, very sticky. All right. A rapid pulse might also be noted, okay? But I think the most obvious signs are paleness, cold and clammy skin. Clammy is like sticky, okay? It's because their body has shifted the circulation from the arms, from the limbs to the center of the body, okay? In an effort to preserve, right, the vital organs, the body automatically takes away the circulation from the limbs, okay, from the arms and the legs. So the body starts to sweat. Okay, increase shallow breathing rate and staring eyes, because this is a very serious situation. If you ever see someone in shock, you should probably start preparing for the worst. Okay, in case they stop breathing, then you have to provide CPR. So what do you do when someone is in shock? Please make sure that you keep an airway open. If they're still breathing, just monitor them. Of course, you activate 911, but make sure that their airway is always open. Call for help by activating 911. Keep them lying down with a head lower than the rest of the body, all right? Now, if you have a chair, you can elevate the legs. If they're in a hospital bed, you elevate the legs, all right? You're trying to return circulation back to the center of the body to preserve the vital organs, okay? If they're bleeding, obviously that has to be controlled using the hemorrhage, okay, management techniques, or whatever other cause of shock. Keep the patient warm, okay? Keep them warm until help arrives. If they still have a pulse and they're still breathing, just keep them warm. That's the best thing that you can do for them. All right. By keeping them warm, you're keeping their circulation to this center part of the body, and you preserve, okay, their circulation and their vital organs, which are the most important. You will see probably questions about this on the national exam, okay, about first aid. CPR and emergency cardiovascular care. All right, so we take this training. If you haven't done already, please let me know so that you can schedule a class. The CPR training, BLS for healthcare providers, basic life support for healthcare providers. This is the one that we use. We do not use the Red Cross. Okay, we do not use any other training aside that is not American Healthcare Association guidelines. All right, and then we go into this, into depth about the compressions, the respirations, the AED, and all that. So please schedule a class so that you can make sure are familiar with the most recent guidelines, right? The compression rate for CPR is 100 to 120 beats per minute, okay? On adults, we usually compress 2 inches. On infants, which is 0 to 1, we compress about 1.5 inches, okay? It's like I said, it's just a class in itself, so we go into that into depth in the CPR class, all right? So let's continue. All right, the last section of this book talks about personal wellness, and we cannot emphasize this, enough. You have to be able to take care of yourself. Nobody's going to do it for you, all right? It's not just about what you eat. It requires like a holistic approach, like all of you, not just your physical body, all right, but all of you. You have to be mentally healthy, right? Mentally stable so that you can perform at your best and work, okay? You need to be have a good relationship, okay, at home. You should be socially, spiritually, okay, and all your economic needs met. If you don't have all these things, in order, that creates a little bit instability in your performance. So make sure that you are addressing every part of your life, okay, not just your physical needs, but every emotional needs, psychosocial needs, and so on. Keep up with yourself, okay. Of course, hygiene is very important, not just for your appearance but for your well-being. All right, what we how we look is what people judge us, okay. So we show up at work and we don't look very well groomed, we don't make a good impression. Remember, we have to look professional. Proper nutrition is obviously essential. It's a basic need. We need food and water. We need to be well nourished to be able to function. Otherwise, we're going to be fatigued and tired and not perform at our best. Rest. We're not machines. We have to rest. We have to get our sleep, at least 6 to 8 hours of sleep. Lack of rest and sleep can lead to fatigue and other medical problems. You will be stressed out, okay? Do a little bit of exercise whenever possible so you can have a healthier life and live a lot longer. Focus on strength, flexibility, and endurance, okay? Like brisk walking, jogging, things like that. You don't have to be a gym rat or anything like that, but do take care of yourself. Most importantly, take care of your back. We talked about body mechanics in our CNE course. The ABCs of body mechanics, good alignment, basic support, and center of gravity. If you don't practice those items all the time, every single time you are going to perform a transfer or a lift or something like that, you have increased your risk of getting an injury, especially back injury. And let me tell you, back injuries are with you for the rest of your life. So you have to make sure that you take care of your own back because nobody else will, okay? Healthcare workers are at risk for back injuries because of activities like lifting and moving patients. It's very important that you take care of yourself, all right? If you cannot move someone by yourself, please ask for help, okay? The stressful environment that we work in can be something very demanding. So you have to learn to manage your stress, okay? So how do you manage stress? Number one, identify the stressors. What is causing you to be stressed? Is it your home life? Is it work? Is it an individual? All right. Only take care of the things that you can control. Right. You cannot control people. Right. So, but you can control your environment. So if you're working in a facility in a setting where you're not entirely happy, you don't feel, you're not happy to go to work and etc. Please make sure you do something about it, because whatever you feel, sometimes we pass it on to our patients. Okay, and that's the last thing we want to do. We don't want to make them feel uncomfortable, or we don't want to show our face like, we're stressed out. People can read us, okay? People can read us. Our body language sometimes is a lot more than what we're speaking. So make sure that your stress management is there, okay? That you make sure that you give it a good presentation, look professional all the time, okay? All right, so we're pretty much done with this section, chapter 3. The main focus, I think, the main takeaway you should get is infection control, number one. Infection control is one of the most important parts of this section for exam purposes. Bloodborne pathogens, all right? Wearing your PPE is very, very important, okay? Some of those first aid measures will be on the national exam. What do you do when somebody's bleeding? What do you do when somebody gets electrocuted? Okay, how do you control a fire? Using race, using pass. Um, what else is going to be covered in the exam? I think there's other questions related to pretty much first aid, okay? How do you help someone that has stopped breathing or doesn't have a pulse? CPR. All right, remember that. So again, thank you for your time. Please make sure to go back and view this presentation again. If you have to listen to it, there is just audio if you want to do that. So please let me know if you have any questions or concerns. For right now, we're done with this presentation. If you have any questions, let me know.